So what kind of treatment do we have for this condition? Well, enough doom and gloom. We've got some really great options for managing allergic conjunctivitis. And the first thing I say is try to avoid the allergen. So if you're going to be going outside, check the pollen count. And if it's too high, then maybe try to do a different activity. If you're going to be doing some cleaning or sweeping, great time to wear a mask to help prevent those issues. And as well, if it's a really windy day, then maybe just keep the windows closed. Number two, besides avoidance, is try to keep everything clean and fresh. So if you're a contact lens wearer, this might mean if you aren't already wearing daily disposables, maybe you switch for this season. The great thing about daily disposals, it allows you to change your lenses every day, have a fresh, clean lens. There's not a buildup of anti-allergen. It also helps with dryness as well. But also that goes to going to bed, is your hair is a really big source that traps all these allergens. So if you can rinse or wash your hair, it's a great thing. Changing your clothes, so don't wear the same clothes to bed that you wore during the daytime. And I know there's a period of my life where we had 4 kids under the age of 7 where you just fall into bed, but if you can avoid that, fantastic. So if you're in that season, I feel for you. But also making sure we change our bedding, so changing the bed sheets and your pillowcases as well. Watch your humidity. If you're in a dry room, then add a humidifier. This just helps your nose and your eyes to do their job, but vice versa. If it's too moist, then get a dehumidifier. This helps to prevent any mold from growing. And then lastly, if we need to, there's awesome drops we can use nowadays. Here at the clinic, we like to use preservative-free drops for our sensitive patients. They come in a regular bottle. The old days of having these little twist-off tabs are gone, so some really good preservative-free options. That helps to rinse out any allergens, but if that's not enough, there are some really great allergy drops we can prescribe for you. In the old days, I'd have to prescribe them weeks in advance and have to use them weeks through things, and it was kind of annoying. Now the allergy drops are such that it's a daily thing. So if today's an itchy, red, watery day, we put a drop in. And if not, we don't have to worry about it. And then lastly, we can use oral allergy medications, over the counter or prescribed. Especially if you're having some nasal or chest issues, it works really well. I tend not to have it be my go-to simply because a lot of the side effects can actually dry the eyes out, and we want to avoid that. So guys, thanks for listening. This has been Dr. Jason Holton from the Eye Studio talking about allergies.